Why only 2.5% of hypertensive Nigerians have their condition under control and what it means for the nation's future by World Wire News Desk. In the bustling cities and quiet villages across Nigeria, a silent killer is tightening its grip. Hypertension, commonly called high blood pressure, is now one of the country's most underdiagnosed, undertreated, and underestimated health threats. According to the Nigerian Hypertension Society, NHS, less than 2.5% of Nigerians with hypertension successfully keep their blood pressure under control. That statistic is not just alarming. It's a call to action. The hidden epidemic hypertension is often dubbed a silent killer because it rarely shows early symptoms, yet it lays the groundwork for heart disease, kidney failure, strokes, and premature death. In Nigeria, nearly 1 in 3 adults in urban areas and 1 in 4 in rural regions are estimated to have high blood pressure. Only 1/3 are even aware they have the condition. Fewer than 10% receive treatment, and just 2.5% manage to control it. These numbers paint a sobering portrait of a country sitting on a public health time bomb. Why so few Nigerians have it under control? There are several deeply interconnected reasons behind Nigeria's low hypertension control rate. 1. Lack of awareness and screening. Most Nigerians do not regularly check their blood pressure. With limited access to screening facilities in rural areas and little routine monitoring in urban centers, hypertension remains undiagnosed until a life-threatening event occurs. 2. Economic barriers. For many, healthcare costs are unaffordable. Blood pressure medication, routine checkups, and diagnostics are often out of reach for those living below the poverty line. This cost barrier leads to inconsistent treatment and follow-up. 3. Lifestyle challenges. Rapid urbanization and dietary shifts have contributed to rising salt, fat, and sugar intake. Physical inactivity, smoking, and alcohol consumption compound the problem. Hypertension is no longer a disease of affluence. It is now a condition of convenience and stress. 4. Fragmented healthcare delivery. Nigeria's health system is plagued by inconsistent policy implementation, weak data infrastructure, and limited physician-patient ratios. These systemic cracks mean that even when patients are diagnosed, they may not receive continuous, high-quality care. Expert perspective. A preventable tragedy drive. Olufenmilayo Adesina, a cardiovascular health specialist, explains, hypertension is one of the most treatable chronic conditions if managed early. What we are witnessing in Nigeria isn't a failure of science, it's a failure of access, awareness, and accountability. Similarly, the Nigerian Hypertension Society has sounded the alarm, calling for a national strategy that integrates routine screening, digital health tools, and improved access to affordable medications. What's being done, and what must be done more? Several positive initiatives are underway. May Measurement Month, a large-scale campaign encouraging nationwide blood pressure screenings from May to July. Public-private partnerships, collaborations with firms like New Heights Pharma, Omron, are increasing access to home-based BP monitors. Research and protocols. NHS is working with the Federal Ministry of Health to develop Nigeria-specific, evidence-based treatment pathways. Still, these efforts require scale, consistency, and grassroots penetration to succeed. A national shift in perspective is urgently needed. Hypertension should no longer be viewed as a condition for the old or the wealthy. It is a national health threat, affecting working-class families, rural laborers, and middle-class professionals alike. Nigeria must make routine blood pressure screening available in every community health center and pharmacy. Subsidize essential hypertension medications and diagnostic tools. Launch national awareness campaigns that target schools, markets, churches, and transportation hubs. Encourage workplace wellness programs and policies that promote healthier diets, physical activity, and mental well-being. Conclusion. Time is blood pressure's greatest ally and enemy. Every day that hypertension goes unchecked, more Nigerians are at risk of avoidable strokes, heart attacks, kidney failures, and deaths. The 2.5% figure is not just a number, it's a wake-up call. A nation that cannot manage its blood pressure will struggle to maintain its workforce, reduce healthcare costs, or uplift its people's quality of life. This crisis is silent, but its consequences will be loud if ignored. Final thought: if we can prevent a crisis with a simple blood pressure check, why aren't we making it happen for everyone, everywhere, every time?